Good morning, everybody.
Good morning.
Good morning.
Good morning, Autumn.
Playbook in the NAFTA negotiations. The idea that Canada has a special place in American trade line.
Good morning, Mr. Smith. Good morning, Ms. Bittner.
Good morning.
Good morning, Dr. Pennel.
Good morning. How's everybody?
Doing good. How are you?
I'm doing great. Thank you.
Us too.
All ready to go?
Yes, I believe so. We only have 3 board members at this time. So we need one more in order to meet quorum.
Okay. I know Dr. Murawsky's not going to make it, right?
Correct. Yeah, he wasn't able to make it. I believe Dr. Larson said she would be able to attend, so she should be jumping on soon here.
Okay, good. So if there's any doubt, excuse me, any doubt on the voting today, well, may have to just do a voice one by one or roll call vote or whatever. Sometimes online it's hard to hear if everybody voted, but if we don't have very many board members, it shouldn't be too difficult, I guess.
Yeah, just let me, oh, I think there's Dr. Larson right there. Good morning, Dr. Larson.
Good morning.
Morning. We all ready to go then, Autumn? We have enough people?
Yes, I believe we have enough. We're good to go.
Good morning and welcome everyone. I call this meeting of the Nevada Board of Health to order 9 a.m. on January 20th, 2023. This meeting has been posted in the appropriate locations in accordance with the Nevada Open Meeting Law. May I have a roll call, please?
Yes. Dr. Pennel,
Present.
Dr. Murawsky, Dr. Ponce, Mr. Smith,
Present.
Ms. Bittner,
Present.
Dr. Larson. You're on mute, Dr. Larson. I see you though.
Present.
Thank you. And we have quorum, Dr. Pennel.
Thank you very much. A public comment period will be offered for each action item as it specifically relates to the action being considered. All public comment not specific to today's agenda will be heard during the general public comment period at the end of the meeting. Because of time considerations, each person offering testimony during the public comment period will be limited to not more than 2 minutes, and a time clock will be kept. Use of obscenities or other behavior which disrupts the meeting will not be tolerated and may result in the forfeiture of the opportunity to provide public comment or removal from the meeting. Action item number 2 on our agenda is approval of the meeting minutes from December 2nd, 2022. Are there any additions or corrections to the minutes? We have a motion then for approval of the minutes, please.
I move that the minutes from the December meeting be approved.
Charles Smith, second.
Moved and seconded. Is there any discussion? Is there any public comment on the minutes? All in favor, please say aye.
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 Chair votes aye. Any against? Say nay. Any abstain? Minutes are approved. Next action item is agenda item number 3, consideration and possible adoption of proposed temporary regulation amendments to Chapter 433 of Nevada Administrative Code, NAC, relating to the 988 surcharge in compliance with SB 390. The proposed temporary regulation amendments will impose a surcharge on telecommunications access lines with the proceeds deposited in the crisis response account in the state general fund to fund the implementation of the 988 National Suicide Prevention Lifeline support centers and mobile crisis teams for persons considering suicide or experiencing behavioral health crisis. We have Frederick Pilot and I believe one other guest, Mr. Pilot.
Good morning, Chairman Pennel and members of the board. For the record, I'm Fred Pilot. I'm Behavioral Health Policy Coordinator within the Bureau of Behavioral Health, Wellness, and Prevention in the division. I have with me this morning Shannon Bennett, Chief of the Bureau, and Shannon Scott, Manager of the Bureau's Crisis Response Section. The proposed temporary regulation before you today is mandated by provisions of SB 390 enacted in the 2021 legislative biennium, requiring the Board of Health to adopt regulations to impose a monthly surcharge on specified telecommunications lines to support the National Suicide Prevention Lifeline Program. Program designates the 3-digit number 988 as the universal hotline for persons who are considering suicide or experiencing behavioral health crisis as authorized by Congress in 2020. The hotline offers 24/7 call, text, and chat access to crisis counselors who can help people experiencing suicidal, substance abuse, and or mental health crisis or any other kind of emotional distress. People can also dial 988 if they are worried about a loved one who may need crisis support. With the enactment of SB 390, Nevada has opted to participate in this federally authorized program. The proposed regulation will levy a monthly surcharge of 35 cents on mobile and landline lines to be deposited in the crisis response account of the general fund to fund the newly created crisis response section within the Bureau and the division, and to provide the following services as authorized by SB 390. First, a call center hub to respond to voice, text, and chat calls to the hotline and coordinate the response to persons who access the hotline. Second, mobile crisis teams to provide community-based intervention, including de-escalation and stabilization for persons who are considering suicide or otherwise in behavioral health crisis. And third, community crisis stabilization units. Additionally, the surcharge will fund federal and state reporting requirements and development of additional regulations as mandated by SB 390, including establishing the qualifications of service providers responding to persons considering suicide or in behavioral health crisis, and permitting communication and sharing of information between persons and entities involved in responding to crisis and emergencies in order to facilitate the coordination of care for these persons who are considering suicide or otherwise experiencing behavioral health crisis. The surcharge is intended to be collected by telecommunications providers and transferred to the division. It will generate an estimated 1.26 million per month and 15 million annually to support the crisis response section within the Bureau. Use of the funds is restricted to the crisis response section and may not supplant existing methods of funding that are available for crisis services. Interest and income must be credited to the crisis response account. Funds remaining in the account at the end of each fiscal year do not revert to the general fund and are carried over to the next fiscal year. The regulation will require telecommunications providers to report to the division annually the number of lines in service subject to the surcharge to provide assistance with revenue projection, to assess compliance, and to comply with state and federal reporting requirements. The regulation takes effect 90 days after it is filed with the Secretary of State in order to allow telecommunications providers adequate time to set up their billing systems to impose the surcharge. During 2022 and into 2023, extensive engagement was conducted over a period of several months with telecom providers in order to develop a practical and workable regulation as directed by SB 390. A public workshop on the proposed regulation was conducted on January 9th of this month. Written comment was received from cable industry stakeholders suggesting revisions to the regulation language and specifically the definition of the types of lines subject to the surcharge. Bureau staff is working and will continue to work with these and other providers following adoption of this regulation to develop a permanent rulemaking that will be brought back before you for adoption following the end of the legislative session in June. Thank you, Dr. Pennel, members of the board. In closing, we recommend approval of the proposed regulation to support the division's crisis response unit activities to serve Nevadans contemplating suicide or otherwise experiencing behavioral health crisis, and to maintain Nevada's position as a leading state nationwide implementing the 988 National Suicide Prevention Lifeline Program. Thank you.
Thank you, Mr. Pilot. Are there questions from the board members at this time for Mr. Pilot? And then I'll open it to public comment.
Chair Pennel,
Yes.
I have a question for Mr. Pilot. Mr. Pilot, this is Trudy Larson. And I noted that there were some very specific requests from Charter Cable. And is that the process that's going forward in terms of moderating these regulations?
Yes, we are working with Charter as well as Cox. Cox filed comment at the public workshop, and we're working with them to address their concerns.
Done in about 15 minutes.
Does that answer your question?
Yes, it does. Thank you very much.
Thank you. Any other board questions, board members? Okay, we'll go ahead and open the floor to public comment. You'll be limited to 2 minutes. Please identify yourself and your affiliation, please.
I see Valerie. I apologize if I'm pronouncing that last name incorrectly. Kahe. You can go ahead.
Thank you so much. For the record, Valerie Haskin, Rural Regional Behavioral Health Coordinator. My board chair and I were actually, somehow this didn't get on our radar until the last couple of days, so we submitted a letter of support for adoption of the surcharge to pay for 988 and other crisis services late last night. I just wanted to make a note that that did come in case it did not have an opportunity to be seen by the board members. We desperately need sustainable funding streams to support crisis services that have only become more needed over the last several years. So thank you very much, and I appreciate the time to speak.
Thank you so much. We appreciate your support.
Allison McCormick, please state your name for the record.
Good morning. This is Allison McCormick from the City of Sparks. I'm calling in support of the proposed 988 fee. We believe at the City of Sparks that it will benefit Nevadans by preventing potential suicides, by Nevadans experiencing behavioral health crises, and providing the right resources to help stabilize them and prevent future crisis incidents. We also believe that it will benefit cities and counties and our public safety agencies by diverting calls to 911 to 988 to get those folks the services and resources that they truly need. It will also mitigate potentially dangerous encounters between law enforcement officers who may not have the training or expertise to deal effectively and safely with folks who are undergoing those behavioral health crises. We believe that those revenues that the 988 fees would generate that would be exclusively dedicated to crisis response would support all of those goals and public safety more generally. Thank you.
Thank you very much, Ms. McCormick.
Julia Ratty.
Hello, my name is Julia Ratty. For the record, I am the chair of the Washoe Regional Behavioral Health Board, and then was also the chair of the Senate Health and Human Services Committee that sponsored SB 390 to move this issue forward. I strongly urge your support of this set of regulations today. This is one of many building blocks that we are working across the state and locally to put in place to transform our response to a person experiencing a behavioral health crisis. I want to commend the state of Nevada, the staff in the Department of Public and Behavioral Health that have worked diligently with their partners over in Medicaid to make sure that we are doing everything that we can to have a sustainable business model for a crisis system of care. But we know that we cannot rely on government or private payer insurance systems for the entire system, as there are always folks who are uninsured or just unable to be covered through those systems. And so we know that this is an essential piece of gap funding to make sure that the person who has experienced a behavioral health crisis always has someone to call. If that doesn't work, someone to come to them. And if that doesn't work, someplace to go. I'd like to highlight that this is very likely, has been proven in other communities who have implemented this type of a system, to reduce costs, and specifically reducing the number of individuals who end up in the emergency room and reducing the number of people who end up in jails. So again, it's better for us, it's better for the patients, it's better for our communities, and I strongly urge your support for these regulations for this key component to make the system sustainable and to make sure that it will be available for Nevadans for many years to come. Thank you.
Thank you, Ms. Ratty.
Gerard Keegan.
Chair, members of the board, Jerry Keegan with CTIA, the Trade Association for the Wireless Communications Industry. We just have two technical amendments that came to light very recently with the proposed temporary regulations. One of those was that Section 2 defines commercial mobile communication services as having the same meaning as ascribed to it at 47 U.S. Code 332D. I would suggest the following. Commercial mobile communication services has the same meaning as ascribed to it as commercial mobile service in 47 U.S. Code 332D. 332D uses commercial mobile service and not commercial mobile communication services. The only other update is to Section 5. The first sentence references all providers of telecommunication services identified in Section 1. Telecommunication provider is defined in Section 2, subsection 1 of the proposed temporary regulations. So Section 5 should state, quote, all providers of telecommunication services identified in Section 2. Those are the only two technical amendments that we have. I'd like to say I appreciate all of the hard work that the board staff has put in and the department staff has put in bringing us together and helping us come to these regulations. Thanks again.
Thank you, Mr. Keegan. Mr. Pilot, is there any response that you have, or I know you've been working together with everybody?
Just to say thank you very much for those technical amendments, and we will certainly take a look at those.
Thank you.
Mary McVicker.
Are we
we get
muted?
Yeah, now we can hear you.
Okay, cool. So as a matter of funding and source funding,
Sorry, really quick, would you mind stating your name for the record? Thank you.
Nate Mills, Dr. Zach Bush and Dr. Shannon Swan, just the two of them. I don't know if the board members are aware of their work, but they have to do with environmental effects on mental health. Dr. Zach, he gets into the Roundup chemical affecting the synthesis of amino acids and how that affects the long-term development of the amino acids as they affect the body, affecting genetic code and all that. So I really think there's enough data that came out in the last 5 years to hold account to the companies and therefore provide funding for mental health, since they're directly related. I mean, they have more money than God, and they've been sidestepping the data with their own counter narratives for upwards of 20 years. And if we're to help us, we can't ignore the elephant in the room. And I think that although Julie pointed out that we can't rely on their funding, I think pressing them will, in the short term, allow some sort of resolution or settlement, because they have a tendency to go out of court. Plus, he also mentions that the projections of autism per population, per capita, will go to 1 in 3 by 2037. So the board members should be aware of the work of Dr. Shannon Swan and Dr. Zach Bush. I yield the rest of my time.
Thank you.
Sandy Stamates.
Good morning. Sandy Stamates for the record. I'm a member of the Washoe Regional Behavioral Health Policy Board and a volunteer with NAMI, the National Alliance on Mental Illness. And I strongly support and urge the state board to approve the temporary regulations. As a family member of an individual living with mental illness, I've had to call the Crisis Call Center, now run by Crisis Support Services of Nevada. They were so helpful to me and my family member. Our family has experienced police response numerous times over the last 25 years. Although there have been officers who have been helpful, what my loved one needed was someone who understood mental illness and was able to de-escalate the situation and provide the correct help needed to get the crisis under control. The new 988 number is operational and already making a difference for families and individuals in behavioral health crisis. Funding for the crisis response account will ensure Nevada is able to meet best practice criteria found in SAMHSA's national guidelines for behavioral health crisis care. Fully trained operators in a crisis call center who can act as air traffic controllers in fully functioning crisis response system, which includes 24/7 mobile crisis response and crisis stabilization centers, must be the standard Nevada pursues and implements. A fully functioning crisis response system will save money and save lives. Thank you so much.
Thank you very much.
Dorothy Edwards.
Good morning, Dorothy Edwards. For the record, I am the Washoe Regional Behavioral Health Coordinator, and I'm speaking on behalf of Washoe County Human Services Agency and authorized to do so on this particular subject. We strongly support the approval and ultimately implementation of this regulation. I yield back my time and thank you.
Thank you very much.
Ben Bird.
Good morning. I'm Ben Bird. I'm outside counsel for Charter Communications. As has already been noted, Charter has submitted written comments in this case and also participated in the earlier workshop in order to raise various concerns that we have with the shape of the regulations. In particular, as CTIA noted, we have concerns with the definitions, the technical definitions regarding which services are captured, and also the application of the surcharges to those various services. We understand that this is just a temporary rulemaking and that there's going to be a final rulemaking later. We look forward to continuing to work with the board to address those issues in the final round. So we appreciate the time and the consideration.
Thank you, Mr. Bird.
Barry Cole.
Good morning. I'm Barry Cole. I'm with the Nevada Psychiatric Association. I'm not officially speaking on behalf of that organization, but I'd like to let you know that many of us at the Nevada Psychiatric Association have been following this since it was enabling legislation, now to implementation. We do support the idea of a robust 988 system, and I would advocate that front-end funding is essential to set the mechanism in place. I understand that there are concerns that perhaps there should be a faded in or graduated tax that could go from 10 cents per line to 15 cents per line over time, but it might make more sense to put more effort in the beginning, stand up a quality program, and then be able to maintain it. When the pandemic began, the Nevada Psychiatric Association independently stood up what was called Curbside Nevada so that we could be available to physicians, nurses, respiratory therapists who were on the front line of the pandemic and had no one to turn to. We had that up and running in 3 weeks and operated it through June of 2000 when state resources were able to be fully implemented. So I would like to support the idea that we get behind 988. We really do it well. If maybe in the future we want to lower the fee, that's certainly possible, but starting out with enough funding, being fully capitalized, will allow this to go forward, and I hope help the majority of people who really want this kind of service. Thank you, and I yield back.
Thank you, Mr. Cole.
Amanda Brock.
Good morning. This is Amanda Brock on behalf of Quest Counseling. I am their community and marketing manager. Quest would like to voice its support for this regulation as it will ensure sustainable funding to provide the 988 service. This service will greatly benefit not only behavioral health providers like ourselves, but government and public safety agencies by diverting calls from Nevadans in behavioral health crisis that would normally be made to 911 to this new 988 service. This service will reduce utilization of public, excuse me? Sorry, this utilization, this would reduce utilization of public safety, first responders, and hospital emergency room stays. It will also help to lower potentially dangerous encounters where law enforcement may lack training to de-escalate a situation concerning behavioral health crisis. Quest Counseling strongly urges the state board to support this new regulation. Thank you.
Thank you very much, Ms. Brooke.
Dr. Pennel, I don't see any other public comments.
Thank you, Autumn. Give a moment. Is there any other public comment? We appreciate everyone calling in today for your public comment. Public
Dr.
health, of
Pennel,
course. Yes,
apologies. One other individual just raised their hand.
please, that's fine.
Go ahead, Kelly Marshall.
Hi, this is Kelly Marshall for the record. I am calling in strong support of the fee as established in the temporary regulations. I believe it is a once in a generation change systemically that will support persons in a behavioral health crisis and experiencing suicidality. And this is an opportunity that will benefit all individuals throughout Nevada as we help our friends, our family, and our neighbors get the much needed help that they need. Thank you.
Thank you, Ms. Marshall.
No other hands are raised, Dr. Pennel.
Okay, thank you. We'll go ahead and close public comment. Thank you all for your comments today. They're greatly appreciated. I know staff, a lot of people have been working on this, and it obviously is very, very, very important. We'll again, Chair will call for a motion then on considering action item 3, consideration and possible adoption of the proposed temporary regulation amendments to Chapter 433 of Nevada Administrative Code relating to the 988 surcharge in compliance with SB 390.
This is Trudy Larson. I would move to approve the adoption of the proposed temporary regulation to Chapter 433 of Nevada Administrative Code relating to the 988 surcharge.
Thank you. Is there a second?
Charles Smith, second.
Moved and seconded. Is there discussion? We have a motion to approve. All those in favor, please say aye.
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 Chair votes aye. Are there any opposed? Any abstain? Okay, motion carries. Thank you, everyone. The chair has been asked to pull action item number 4, and it will be placed on another agenda. Agenda item number 5, consideration and possible adoption of proposed regulation amendments to Chapter 440 of the Nevada Administrative Code, NAC LCB file R111-22. The proposed regulation will clarify information relating to vital records, including time constraints, how to fill out the cause of death, determining responsibility for signing a death certificate, requirements for home and delayed birth registrations, language replacements on foreign birth certificates, requirements for paternity and parentage, residency requirements during adoption, and provide gender identity options on death certificates and the evidence needed to correct the gender on a death record. Is Stephanie Herrera present, please?
Yes, I'm here. Thank you. Good morning, Chairman and community members. My name is Stephanie Herrera, and I am the Program Officer 3 for the Office of Vital Records within the Department of Public and Behavioral Health. I also have Shana Reinhart with me today. She's a Management Analyst 1 for the Office of Vital Records. The proposed regulation changes to NAC 440 are in response to instruction from the Nevada State Legislature Sunset Committee to clarify regulations. The Office of Vital Records also took this opportunity to review the entire regulation and propose some other changes that we are hopeful will make them clearer. We also reached out to numerous stakeholders for their input, including but not limited to Washoe and Clark County medical examiners and the county health departments. The proposed regulation changes align the signing time limits of physicians with the NRS, clarifies the language on how a medical certifier fills out the medical portion of a death certificate, clarify who is responsible for signing death certificates, including when a coroner or a medical examiner needs to sign a death record, clarify responsibility of transferring the death record from one funeral home to another, and clarify the paternity identification requirements, clarifying the process for English translation of a foreign birth certificate for use in the United States, providing guidelines for gender identity of decedents and their correction, and to clarify required documentation for a delayed birth certificate. A small business impact questionnaire was sent to 4,362 entities, and there were no direct adverse impact noted. On November 14th, we held the public workshop. No concerns were addressed during that workshop either. Thank you very much for your time today.
Thank you very much. Are there any questions from the board members? We'll open up to public comment then.
Chair Pennel, no hands are raised at this time.
Okay, thank you. So on agenda item number 5, I'll ask for a motion, please, for consideration and possible adoption of proposed regulation amendments to Chapter 440 of NAC LCB File R111-22.
Judy Bittner here, make a motion to approve NAC 440 in LCB file R111-22.
Thank you. Is there a second?
This is Trudy Larson. I second.
It's been moved and seconded. Is there further discussion? All in favor of the motion to approve, please say aye.
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 Chair votes aye. Any opposed? Any abstain? Motion carries. Thank you. Agenda item 6, consideration and possible adoption of proposed regulation amendments to Chapter 458 of Nevada Administrative Code, LCB File R117-22. The proposed regulation will update language relating to substance use prevention and treatment agency certifications throughout Nevada. And I ask for Ms. Stephanie Cook, please.
Good morning, board members, and thank you, Chair, for the opportunity to speak before you today. For the record, I am Stephanie Cook, Health Program Manager overseeing substance use treatment programming within the Bureau of Behavioral Health, Wellness, and Prevention. I am presenting to you proposed regulations drafted as R117-22. A core function of the Bureau is SAPTA certification for substance use treatment and prevention agencies, as outlined in NRS and NAC 458. Specifically, requirements for certification are specified in NAC 458. Certification ensures entities are providing quality substance use services, aligning with proper clinical protocols and procedures. During the 81st legislative session in 2021, SB 69 was passed, codified now as NRS 458.033. This was a comprehensive bill with various provisions, one of which requiring the State Board of Health to adopt regulations providing for the certification and duties of substance use disorder prevention coalitions, which are coalitions of persons and entities who possess knowledge and experience related to the prevention of substance misuse and substance use disorders in regions of the state. This also gave the Bureau the opportunity to clean up language within our regulations to remove stigma relating to the use of substances. SAPTA certification is conducted through an agreement in partnership with the Center for the Application of Substance Abuse Technologies, otherwise known as CASAT. CASAT has been instrumental in assisting with the creation and updates to this regulation, performing stakeholder outreach throughout the last year, engaging with community partners to ensure input was received and worked through, and working with Bureau staff to clean up language within the regulations. A public workshop was held on Monday, January 9th, 2023, in which the proposed regulations were presented. No public comment was received. In summary, the proposed regulations to NAC 458, as described in R117-22, include establishing provisions relating to substance use disorder prevention coalitions, revising definitions related to alcohol or other substance-related disorders, revising the documentation that an operator of a program to address substance-related disorders is required to provide with an application for certification or recertification of the program, revising the requirements that must be met for the division to amend the criteria of the division for the prevention or treatment of a substance-related disorder, cleaning up language concerning the fees charged and collected for the certification and recertification of programs and services provided by the programs, revising the policies and procedures that must be included in certain program manuals, imposing on an operator of a program certain requirements related to confidentiality and record keeping, revising requirements concerning systems for maintaining records of members of the staff of a program, increasing the passing score on an exam for certification as a detoxification technician, and replacing language not preferred for use regarding alcohol and substance use disorders in programs. For, as an example, updating substance abuse to substance use. One thing to note, in Section 9, the Bureau is requesting LCB to update the language to add text revision to the Diagnostic and Statistical Manual of Mental Disorders, DSM, instead of documenting the 5th edition to eliminate the need for further revisions when the publication is updated. We encourage your support in approving the proposed revisions to NAC 458. Thank you for your time, and I'm available for questions.
Thank you, Ms. Cook. Are there any questions from board members?
I don't have a question, but I have a comment. I'd like to commend the staff for the thoroughness that I read through with this proposed regulation.
Thank you. Any further comments or questions from board? Ms. Blutman will open it up to public comment, please.
Mary McVicker.
Hi, I just wanted to ask if there's any infrastructure or thought into post-clinical treatment. I know.
Can you go ahead and identify yourself, please, sir?
Oh, Nate Mills. Yeah. So what I was getting at, substance abuse is largely a behavioral thing, where the 5 basic like situations perpetuate it. So is there any thought into post-treatment, like groups or social things? I find that if you put people into a situation where they can start contributing, that has been shown in European behaviors to like lower depression and other anxiety things and get people re-socialized. Is there any funding or foresight into groups that would get involved with agriculture or any other kinds of contributing social factors, social things? The equivalent of the infrastructure for Veterans Affairs, but on a civic rehabilitation kind of mindset. I yield the rest of my time.
Thank you, Mr. Mills.
I just want to interject really quick. Public comment is usually just meant for comment, and oftentimes we aren't able to provide an answer back to answer questions. But you can absolutely email your questions if you would like to connect with our staff via the State Board of Health email address at the bottom of the agenda.
Okay.
Any further public comment?
No public comment, I don't believe.
Public comment is closed. Go ahead and ask for a motion from a board member on amendments to Chapter 458 of Nevada Administrative Code, LCB file number R117-22, please.
Yes, Charles Smith, I make a motion to approve LCB file number R117-22, proposed regulations, the Board of Health for amending NAC 548.
Thank you. Is there a second?
I second that motion.
It's been moved and seconded. Further discussion? All in favor, please, of approval, please say aye.
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 Chair votes aye. Any opposed? Any abstain? Okay, motion carries. Thank you. Consideration, next action item on the agenda is number 7, consideration and possible adoption of proposed regulation amendments to Chapter 441A of Nevada Administrative Code, LCB file R153-22. The proposed regulation adds new language to NAC 441A defining suicide attempts, specifies healthcare providers and settings subject to mandatory reporting of attempted suicides, specifies patient information designated healthcare providers in settings must report, and establishes procedural requirements for reporting of attempted suicides. Ms. Yvonne Allen, please.
Good morning, and thank you, Chair Pennel and board members for the opportunity to speak to you today. For the record, I am Misty Allen. I'm the Suicide Prevention Coordinator for the state of Nevada with the Bureau of Behavioral Health, Wellness, and Prevention. I am presenting to you proposed regulations drafted as R153-22, mandated in the 2021 legislative session by AB 181 and codified in NRS 441A. .120 and 441A.150. We are asking for your approval to revise Nevada Administrative Code 441A infectious diseases reporting concerning communicable diseases, overdose, and attempted suicides. Right before the pandemic, Northern Nevada experienced several deaths of our youth by suicide in a very short amount of time. At that point in time, we were drafting emergency regulations when the pandemic hit, and all energy turned toward monitoring and reporting of COVID data. Toward the fall of the shutdown, we saw another spike in youth suicide in Southern Nevada. We felt emergency suicide attempt reporting regulations needed to be revisited. Nevada has always experienced high suicide rates. This was the opportunity to utilize a data reporting system to gather crucial information and take quick and effective actions to mitigate suicide risk for those who have attempted suicide. To implement this data reporting quickly and without having to create a burdensome new methodology, it was decided to use the same reporting mechanism as the overdose reporting system developed in 2018. This is so important as we know those surviving a suicide attempt most often will not go on to attempt suicide again if they are connected to the right treatment, resources, and systems of support. We reached out to numerous stakeholders, specifically including the Nevada Hospital Association and Nevada Rural Hospital Partners to hear concerns, and language was adjusted to meet those concerns. So a summary of LBC file R153-22, amending NAC Chapter 441, is in compliance with SB 181, directing the State Board of Health to adopt regulations governing the procedures for healthcare providers to report cases of suicide or a suspected attempted cases of attempted suicide or suspected attempted suicide to the chief medical officer or his or her designee. The proposed language defines attempted suicide for the purposes of reporting attempted suicide, specifies healthcare providers required to report a case of attempted suicide, and the information and procedures for submitting reports. Additionally, the proposed amendment would require the division to compile an annual report summarizing the information submitted to the chief medical officer of the affected healthcare providers and submit the report to the Patient Protection Commission created by NRS 439.908. Healthcare providers affected by the proposed amendment are community triage centers and hospitals, including rural and psychiatric hospitals. The reporting of a suicide attempt or suspected suicide attempt should occur no later than 30 days after discharging the patient. Healthcare providers required to report a case of attempted or suspected suicide that willfully fail, neglect, or refuse to comply with this requirement would be guilty of a misdemeanor subject to an administrative fine of $1,000 for each violation as determined by the Board of Health. We encourage your support in approving the proposed revisions to NAC 441A. Thank you for your time, and I'm happy to answer any questions.
Chair Pennel, you're on mute.
Whoops. I guess I've gotten used to being back in person. Ms. Blattman, hearing no questions, we'll open it to public comment. Thank you.
Barry Cole.
Hi, Barry Cole again. As I said, I'm a psychiatrist. I'm a member of the Nevada Psychiatric Association. We are obviously in favor of anything that helps get people in crisis to crisis services. I understand the desire to have this legislation, and one of my colleagues, Leslie Dixon, wishes that there could be more robust understanding of the dynamics that lead people to suicide. Please recall, this is often a very impulsive decision that happens in a matter of minutes, and that may complicate whether or not it will always be reported. In my more than 40 years as a psychiatrist, I have had many patients tell me after the fact that they had had a suicide attempt, but that they slept through it, woke up a day or two later, and just got back on with their lives. So there will always be some element of underreporting, but no reporting means we have nothing to study. So one of the truths in medicine is you can't study it if you don't measure it. It will be very important that we try to measure as many suicide attempts as possible. Especially, I would think this would be most interesting for the rural facilities where there's an underservice of mental health professionals. Even in larger communities, Washoe, Clark County, there will still be need to track who's attempted suicide and whether or not that's actually fundamentally different from accidental overdose. In the overdose community, there is some thought that some who overdose on opioids are actually deliberately attempting to overdose. So what is called an accident may or may not be. I applaud any efforts to get more fundamental information, and certainly my colleagues in the Nevada Psychiatric Association would like to work with you on evaluating this information. I yield back.
Thank you very much, Dr. Cole. Is there further public comment?
No, I don't see anyone's hands raised, Chair Pennel.
Public comment is closed. I'll call for a motion on possible adoption of proposed regulation amendments to Chapter 441A of NAC LCB file R153-22.
Charles
This
Smith.
is Trudy Larson. Oh, go ahead, Doc. Go ahead, Mr. Smith.
Charles Smith, I make a motion to approve LCB file number R153-22 with proposed regulation amending NAC 441A.
Is there a second? Thank you.
I second that motion.
It's been moved and seconded. Is there further discussion from our board? Hearing none, all in favor of approval, please say aye.
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 Chair votes aye. Any opposed? Any abstain? Motion carries. Thank you very much. Does the board members have any recommendations for future agenda items? Is there any public comment on future agenda items?
I see none, Chair Pennel.
Thank you. We will now open the meeting to general public comment. No action may be taken on the comment today, but you are free to talk about whatever you have under consideration. Thank you.
Chair Pennel, I see no hands raised.
Thank you, Ms. Blattman. There's no public comment for the last agenda item. I want to thank everybody, thank the board members, thank the staff for all their hard work and keeping all Nevadans safe and healthy. I know all of you work very hard, and then I want to thank everybody that called in today for public comment too. We do appreciate your input, and I hope everybody has a great weekend. This meeting is adjourned. Thank you.
Thank you.